Americans Housing Real Estate Limited, the East African University Bradgate International Nyeri, Great Farm Properties Limited, Silverbrook Hotel Othaya, Marege Tamo Products Limited, Real Driving School, na Sheni Supermarket, na Nyige. Igogona lele, leka memelekyo live, imwe kwa imwe kugera TV wedete ya GTN TV. Nitoshe mania Jumapili ne watariki 3 Dithemba, kanitha-ine wa Full Gospel Rolling Scooter, tunyitire kiheo kia mwanya gia Favored Boy Child, tuwikagira woira kana gagiciarwo, titago kugutirago.
Guthoma to guthoma na makiri gwakinya ni kothi cia moko ndugatangike ringi amu Aberdare Institute of Management Karatina mari haha ni undu waku marakumenyithia woyani wa January intake ni urathi na mbere ni nguthi cia uthomithani wa kothi ta hospitality management kana catering, hairdressing and beauty. Ondi thomithagia mathomo ma computer studies na ICDL. Gwakinya ni rugiri wa mathomo ndukagie na nganja kuona ntwandikithite no honge rwa TVET na arutwo aitũ tumateithire kwĩgwatĩra attachment na kũrĩa arutwo arĩa kũraihu ni ũndũ wa gũkoma itũrĩ na hostels. Kũhoro makĩria tucere thukuru-inĩ witũ mwena wa Karatina mita 500 kuma barabara-inĩ ya Karatina gũthiĩ Nairobi kũng'ethana na Brookfield Academy kana ũtwarĩre kũgera thimũ namba 0726 507 444 kana thĩinĩ wa rũrenda rwitũ nĩ ruo www.aim.ac.ke. Aberdare Institute of Management Karatina, aiming beyond the ranges.
Most of us, if not all of us, have had to use antibiotics at some point in our life. Now, do you remember a time we were given such medication, be it antibiotics, antifungal, antiparasitic, and you felt like this is not working for me, and you went back to your physician and they tell you that you'll need stronger medication for you to get well. Now, that is antimicrobial resistance, which we are going to be talking about today. In this regard, every 18th to 24th of November each year, we observe the World Antimicrobial Resistance Week in accordance to the World Health Organization. This year, under the theme Preventing Antimicrobial Resistance Together. Is it such huge of a giant? Let me paint the picture for you. Antimicrobials are considered the cornerstone of modern medicine. What do I mean when I say modern medicine? Procedures like surgery, every time you get your tooth replaced or removed, that is modern medicine. Not withholding that, according to the World Health Organization, resistance of antimicrobials resulted or contributed to 5 million deaths in the world and directly caused 1.27 million deaths. So yes, it is a big issue, and that explains the alarming concern and the alarming rate at which we are running to save the situation. So join me and Dr. Ken as we are going to unravel this situation for you. And what is your part in all of this? What is the part of health workers? What is the part of our government in preventing antimicrobial resistance? So join me and Dr. Ken for more.
Special greetings and thank you so much for choosing GTN TV. As I said, we are here with Dr. Ken, who is going to be taking us through this interesting topic. Karibu sana, Dr. Ken.
Thank you very much.
Yeah, and thank you for making time for us. Can you take a moment and tell our viewers more about yourself, who you are, where we are, and what you do?
Okay. Hello viewers, I'm Kenneth Mwangi. Mission, I work in St. John Divine. We are in Chaka. Yes.
Thank you so much. So last week, we've been observing the World Antimicrobial Week. Now, once you mention that antimicrobial, everyone is questioning, what is that? So can you tell us what is antimicrobial even before we talk about its resistance?
Yes, an antimicrobial is any agent that kills a microorganism. Yes, may it be an antibiotic, an antifungal, antiparasitic, antivirus, the drugs that are used to treat virus, HIV, antibiotics, like drugs which treats TB, common colds. Yes, those are in the category of antimicrobial.
Oh, you talk about microorganisms, so we are talking about fungi.
Yes, fungi. Yeah. Bacteria.
Viruses and such.
Yes.
Okay, so what is the resistance of the same? What is antimicrobial resistance?
Now, once you have an infection, we have a microorganism that is attacking the body system. Now, this is where now we use the antibiotic, antiparasitic, antivirus, or antifungal. So now, when we talk of resistance, it is actually the ability of microorganisms to continue growing in the absence of an agent or a drug that is meant to kill it. Yes.
So that means someone is taking the medications, the antibiotics, and then they are not getting better.
Yes.
So that sounds like quite a threat. So what are some of the drivers? Why would this happen?
This mostly happens because of maybe overusage of antibiotics, or under dosage, or wrong prescriptions, or misdiagnosis, or in the time a patient lives in environments that will expose him to infections. The patient will be attacked with the microorganisms and will need antibiotics more and more and more and more. Yes. The other thing, our patients are used to self-medicate themselves. Yeah. And this is very common mostly in the sub-Saharan Africa, in Africa at large. And in our setup, Kenya, this is where you find patients don't want to go to the hospital for a technical, a clinical examination. They want to buy drugs over-the-counter drugs. Yeah, I would advise patients to get a clear diagnosis in a hospital, and then get a good prescription before they purchase in a drug in our drug stores. Yes.
Among the causes or the contributing factors that could make maybe a person becomes resistant to certain medication, you mentioned overuse.
Yes.
Now, break it down for us. What is overuse? Is it that a doctor could give you more medicine that you need, or is it when people are medicating themselves and they take more than they should have taken, or is it that over time? For instance, I'm treated this particular time, I'm given antibiotics, I am sick another time, I get antibiotics. What exactly do you mean when you say overuse?
Or when I say antibiotics overuse, we usually have overuse. We also have misuse, we also have underuse. So when we talk of overuse, it's where you find a client taking antibiotics anytime he gets any kind of symptom, maybe a fever, find a patient getting an amoxicillin in a nearby chemist, maybe a headache, a patient will get an injection. You see, that's how the microbials will get used to the antibiotics, and they will mutate, they will change their forms, and they will get used to the antibiotics, so that when the patient will need the real medication, the antibiotic will or the microorganism will have already get used to the antibiotic or antiviral drug. So it will be of no use the patient. Yes. Yeah.
Does our environment in any way, is it going to contribute to that? For instance, we have people living in slums.
Yes.
Is that going to contribute in any way?
Okay. Now, in our major cities or even in the rural areas, we have people who have a low socioeconomic life, and they tend to live in semi-permanent houses, which is okay. We also have poor sanitation. In the slums, we have poor sanitation, poor drainage. We also have patients who are people. It's so densely populated that even the increase in infections I've seen in the slums. Even the aeration, get that in those areas, you see TB, waterborne diseases, diarrhea, cholera. Yes. So that's how the slums affects. Yeah.
So generally, living in an environment that is not very clean.
Yes. Yeah.
So we can start from home, making sure that where we are living is a clean place. Sometimes people go through some medical procedures, for instance, surgery, and then they have to be given some antibiotics and such drugs to make sure they don't contract further infection. A threat to modern medicine.
Yes, very much. Thank you for bringing that up. Most of our patients, like in our facility, usually do, or anytime you do a major surgery, maybe a CS, or a total hip replacement, or total knee replacement, or removal of the uterus, removal of fibroids, or any major surgery, you need to cover the patient later because of there's something we call the incision site. The incision site, it's where you cut the body so that you can access the tissue that you want the body. So that wound, it will undergo a process called wound healing, and it's prone to a lot of infections. So for us to avoid infections, we use antibiotics. So it's a very complicated condition when the patient is already resistant to most of the antibiotics, even the second line, the last resort antibiotics. So we may lose a patient once he or she is resistant to all the antibiotics. So it's causing more harm. The resistance is causing more harm once the patient is resistant to most of the antibiotics.
Mm-hmm.
Yes.
And coming here at home, let's talk about maybe in our country,
Yeah.
but in this region, the Mount Kenya region, maybe. What is the main cause? What can you attribute to drug resistance among patients in this area?
Now in our region, we have poor access to clean water. Also the sanitation and hygiene, poor infection and disease control. We also have lack of awareness and knowledge. We also have the vulnerable populations, that's the elderly, very young, patients who have chronic conditions. Yeah, when I mention of chronic conditions, there are conditions that lowers the immunity of the patient. Yeah.
Such as?
Maybe we can talk of HIV, we can talk of TB, we can talk of even the non-communicable diseases, the diabetes, hypertension. Yeah, so that's the vulnerable populations. We also have the awareness of medication, which is the most concern in our region. Yeah. Self-medication and overuse of painkillers. Every time a patient gets a headache or a joint pain or a lower back pain, actually this region we have, we are Bantus and we have to work. So most of the people who have their back. So we get to see patients with lower back pains, excruciating pains, and now them, or the arthritis. I'm sure you have heard of arthritis from where you come from. Yeah, the arthritis, the knee joints pains. Yeah, and it's usually very complicated because the pain will never disappear. Yeah, the pain will never disappear. If you have a reduced joint space, so the joint will keep on. Yeah. We have now in the lower back, we have disc compressions, we have nerve compressions, we have fluorosis, things like that. So I want to advise the population, the viewers, go to the hospital, get a good prescription, and purchase your drug. Yeah.
Dr. Ken is politely telling you that you're not a doctor. Stop treating yourself. Visit a hospital every time you feel like you need a medication, because if you continue using these painkillers, they may not be effective the very time you need them. See you in our next segment.
Sharia hado ugithomera gukunya gita, piano kana migambo niyo vocals. Rehoboth School of Music maheyanaga mathomo ma kirathi kia iguru muno. Macerere Nyeri Town haria opposite Naivas Supermarket, kana waranirie nao kuhetukira namba cio cia thimu 0715 031 506. Rehoboth School of Music, cama wa rwimbo ni inanda.
Yene koe na leto yaku
Nancy Gishimo niragutira igongona ria Mugitiri Album Lounge tariki 3 mweri wa Dithemba mwaka uyu turi kwambĩrĩria 7 cia mĩaraho kũrĩa kanitha-inĩ wa PAG taũni-inĩ ya Nyĩrĩ kũng'ethera Cooperative Bank. MC wa igongona rĩrĩ nĩ Ng'ang'a Tito, nakĩo kiugo ĩkaheanwo Bishop Rũkwaro wa PAG Church. Gũkũ nakĩo kĩgoco gĩgĩtongorio nĩ Charles Kĩng'ori, Ng'ethe Steve, Pastor Jacinto wa Marera, Moni K hamwe na aini ingĩ. Igongona rĩrĩ rĩrũgamĩrĩirwo nĩ Generation Furniture, Dolphin Fish Mongers, Nyeri New Choice Hardware na Kiawara Onion Traders. Kũingĩra gũtirĩ na marĩhi. Inyuothe mũrĩ anyite ũgeni.
I'm back. Now, before we went for the break, Dr. told us about the dangers of self-medication. But now again, Dr. like these people, they come to the hospital, you prescribe them a medicine, a dosage, and they never get to finish it. Is that also a risk?
Yes, that's a very it's a grievous risk. The moment you won't complete the dose of the antibiotic, remember microorganisms are very tactical with time. They tend to change their form. They are very tricky when you mess with not completing the antibiotics. They will create a resistance which in future that antibiotic won't be susceptible, they won't feel the effect of that antibiotic with time. And once the antibiotic creates a resistance, they copy that to the DNA, so that the next time that bacteria will start replicating, it will replicate with the resistance. You see, so now if it creates a resistance in the 21st century, it will be very difficult for it to go back. You see, so that's something most of our patients do not understand. That when you mess with your dose, if it's a dose of 5 days, those are the common days we usually prescribe them. 5-7 days. If it's 7 days, kindly take 7 days. If it's 5 days, kindly take 5 days. Because today you will come, we'll give you Septrin, you go mess with Septrin, you won't complete the dose. The next time you come, Septrin won't be active to most of the microorganisms that will be affecting you. So we'll give you amoxicillin. Go to amoxicillin, you mess with the same dose. The bacteria are keeping a record. So now you go to cephalosporins, you go to augmentin. I understand most of them use augmentin even for common cold. Do people use augmentin from where you come from? Yes.
You have that, is it a method?
Yes.
The step doctor has really that what is going to treat the flu.
Yes. So let us use the guidelines. Every now and then the government gives us the current guidelines, and the major organizations like the WHO, CDC, the Center for Disease Control. So now once the patient is done with the common antibiotics, we will now go to use the last resort antibiotics. They are called meropenems. So now, when we are done with the carbapenems, we shall have nothing to do with that patient. You see, there's no antibiotic in this world that will help the patient. So you see, that's quite risky. It's quite risky. This thing, it's a silent killer, globally. And I would like us to the major organizations that records the statistics of these conditions to be by grant this.
So Dr. Even as we're trying to create awareness on this whole issue, I think we also have a lot of myths. Maybe help us know if this is the truth. There are people who say that the moment you're not finishing the dose, mwili yako itazoea hiyo dawa.
Yes.
The next time unaikunywa, ulishazoea, kama kuna some medicine you're taking. Is that actually true?
Kuzoea dawa. Hiyo ni kweli, mwili itazoea dawa. Na hiyo ndio kichina hata yenye tunafaa kuongelelea hapa sasa hivi. Mwili kuzoea dawa ni hiyo bacteria, hiyo germ. Hiyo tunaita germ. Hiyo germ itazoea hiyo amoxicillin. Na next time haitatumika tena.
Also, we also have cases where cases of misdiagnosis that you're told you have this disease or maybe you have another disease and you are given medicines that treat disease A while you have disease B.
Yes.
Is this also going to raise chances of one becoming resistant to antimicrobials?
Yes, we call it misdiagnosis. Misdiagnosis is it's something that is very common in our country because you get unqualified medical professionals or courts, or just people who are negligent. That's I call it that's doing injustice to the patient. You see, the moment a patient comes with condition X and you diagnose condition Y, without even another physical examination, without medical tests, without taking a good history. Let us listen to our clients. When a client comes, listen to the client and explore all the angles, and you come to the closest diagnosis, so as to avoid the wrong diagnosis. Because with the wrong diagnosis, you will give the wrong medication, isn't it? With the wrong medication, so it means that you will just be misusing that drug. Let's say a patient needs a drug to cover maybe a virus, and you give a drug to cover a bacteria. With that bacteria or antibiotic, it won't work to the viral condition. See, so that will be drawing the patient closer to the assistance.
And is there a certain age bracket that is at risk, or is anyone at the risk of resistance, antibiotics resistant? And also while you look at it, maybe you could tell us, are there chances that it is going to occur naturally, you don't have any of these contributing factors, but still it happens?
Oh, no. That's a very good question. Resistance. Number one, resistance cuts across all the population, everybody. It can cut in every patient, in age, in geographical occasions or regions. Yeah. Number two, when we talk of age bracket, we want to see who are more at risk of the infections. Number one, you get it's under 5. Under 5, to magonjeka sana because you see the immunity is low. Yeah. So they are each and every month they must go to a facility and get the antibiotics. So by the end of by the 6th birthday, the child will be resistant to 1 or 2 antibiotics, and that's very serious. So now the elderly are also very vulnerable to the conditions because you see the immunity level it's a bit low. And now the immunosuppressed. We are talking of patients who have viral conditions. Yeah, whose the immunity is very low. Yeah.
This is not only affecting people or human beings, it is also affecting plants and animals. Now, is there a way that this can be linked to also antimicrobial resistance in human beings? Like when we are eating foods that have been sprayed, is it going to affect us?
This thing will affect us as much as it's being sprayed into the plants. Number one, these research institutes, they should avoid pumping a lot of antibiotics to the plants and a lot of sprays, because the moment they treat those even the animal industry, the animal health industry, the moment they overtreat with antibiotics, it's believed that 85% of the antibiotics are excreted, and once they go to the ground, the plants will take it, and now when the plants take it, we take it. It's a cycle. That's why you find there's something called the global action plan, where we find those 3 sectors must come together. That's the food and agriculture organization. That's the FAO, Food and Agriculture Organization of the United Nations. We have the World Organization for Animal Health, WOAH, and now the World Health Organizations. Those three major organizations. They came together because this thing is interconjoined. The food and agriculture industry, the animal health industry, and now the human health. Yes.
Okay, and sometimes you're given some antibiotic, antifungal, such medication, and you're told when you're taking this medicine, don't take certain foods, but take these medicines along with maybe milk.
Yes.
Why so?
Okay. Now what happens? Most of these foods, maybe like we should avoid high acidic foods. They affect the absorption, and maybe they might affect the pH of the drug. We may also want to avoid high fiber diets. You may also want to avoid when I talk of milk, the lactulose. Milk affects and absorption of the antibiotics, because when they go the binding process, you find that the lactose will affect. But on the same note, I know to exclude the yogurt, the fermented milk. The fermented milk will be of no effect. It actually maintains the gut. But milk, I'm sure ukishaenda hospitali unasikia hiyo usikunywe na maziwa, hiyo usilimi. Yeah. The moment you take with milk, it will definitely affect the absorption of the antibiotic. Still on the same, there are drugs that you are told do not take when the stomach is empty. Others you are told take when the stomach is full, isn't it? So some drugs work better when the stomach is empty. Others work better when the stomach is full. So you should be able to differentiate between those two and follow the doctor's advice. We also have the sugars. The sugars. Sometimes there are drugs which you may not want to take with sugars. Yeah. Because still on the same note, sugars encourages growth of microorganisms. And also on women, they may develop yeast infections because of the same. And alcohol. We all know alcohol, what alcohol does. So we should avoid alcoholic drinks.
Yeah, this is the dire situation we have at hand. Can you imagine yourself at the most vulnerable stage? You are sick and there is no medicine that can treat you. This is extremely serious and it is a threat to human life. So let us find out what can we do, what is our responsibility as an individual, what is the responsibility of the health sector and even the government in preventing antimicrobial resistance in our next segment. Stay tuned.
Guthoma to guthoma na makiri gwakinya ni kothi cia moko ndugatangike ringi amu Aberdare Institute of Management Karatina mari haha ni undu waku marakumenyithia woyani wa January intake ni urathi na mbere ni nguthi cia uthomithania wa kothi ta hospitality management kana catering, hairdressing and beauty. Oni thomithagia mathomo ma computer studies na ICDL. Gwakinya ni rungiri wa mathomo ndukagie na nganja kuona nitwandikithĩtie na rũhonge rwa TVET na arutwo aitũ tũmateithĩre kwĩgwatĩra attachment na kũrĩa arutwo arĩa kũraihu nĩ ũndũ wa gũkoma itũrĩ na hostels. Kũhoro makĩria tũcere thukuru-inĩ witũ mwena wa Karatina mita 500 kuma barabara nene ya Karatina gũthiĩ Nairobi kũng'ethana na Brookfield Academy kana ũtwarĩre kũgera thimũ namba 0726 507 444 kana thĩinĩ wa rũrenda rwitũ nĩ ruo www.aim.ac.ke. Aberdare Institute of Management Karatina, aiming beyond the ranges. Gwatira andika maundu tasikiza tuni ya thimu yaku hihinya *837*321# na igwatire rwimbo rũrũ ta rũgambi rwa thimu yaku.
how we can prevent drug resistance, because as you can see, it is a very serious situation. It is a silent pandemic. You don't know the danger you're causing yourself every time you buy medication, every time you don't complete a dosage. So, Dr. Lee, if you could break down for us what is the contribution, because what I'm gathering is that this is a situation that requires all of us together in order to prevent it. There is what a health professional is supposed to do, because for instance, you talked about misdiagnosis. Also, as an individual, I believe we have a contribution. What can we do to prevent and control the situation at hand?
Antibiotic resistance is something that we can all be able to control if we attack it through all subsectors that deals with health. Number one, it must come from deep within us, and be aware that every time I misuse an antibiotic, I'm doing a grievous harm to my health. Yeah. So, number one, we may start with the individual contribution. Number one, never go for self-prescribed medications. That's the over-the-counter drugs called the OTCs. Avoid as much as possible self-prescribing. Number two, make sure you complete the antibiotic that you have been prescribed. Make sure you complete it up to the last day. There's this common scenario where a patient is prescribed medicine or drugs. On the second to the third day, the patient feels well, isn't it? Yes. Nasikia umepona, hauna joto, kichwa haiumi. So, what do most people do?
The medicine.
Yes. Yeah, so that's what has been happening for so long. Patient nasikia vizuri sasa. Hizi dawa zinafanya nisikie kutapika, unazitupa. You should let the patient know that the bacteria has not yet been eradicated. Yeah? So the next time you are sick, you get sick, the bacteria will already have copied, and it will already have denatured itself, and it won't be active, that antibiotic, for life. It's something that it's not tangible, you cannot see. Watu hawezi jua ile makosa yanafanya, kitu haionekani, unaona. But with time, hizo dawa zinakuja zinakataa kazi. Number two, so in the individual contribution, you remember the pandemic, the time of the pandemic, COVID-19. Yes. You should not get close to patients who are infected. You should avoid much contact with patients who are infected with contagious diseases. It's a complicated condition because you have a relative who is sick. Sasa daktari anasema tusimkaribie. Unaona? Watu wakaribie mgonjwa pate kama ni everything viral, watu wanaweza vaa zile mask. Nakumbuka hii type ya Ebola. Hii Ebola ilikuwa Sierra Leone. Ilikuwa wakati mgumu sana watu kuwatibu. Because unatibu mtu maybe akikosa kumake ama patient maybe akosa kumake akufe. Hiyo body ukirutishia familia, they will have to wash the patient. I don't know what they do with the water. I don't know the
Culture stuff.
Culture stuff. Very complicated. The patient will have to spend in his bedroom with the spouse. So at some point, you won't be given the body won't be buried the normal cultural procedures. The public health will have to intervene. So stuffs like those laid back cultural activities, we should avoid them. Yeah. So yes.
But is it for individual responsibility?
Yeah.
So I also believe that as health workers, you have a part, you have a role to play in this. What is your part?
Okay. In the health department, we have the biggest role in this menace. In this menace, right now it's a national. It's a global. It's a global menace. We need to do something about it. We need to stop it. As the health professionals, the health managers, the people who manage the health sector, the practitioners, they should be able to insist to the patients that the importance of completion of antibiotic. But two, they should always make the right diagnosis. And there's something that I said, the family is part of management. Once you get that you are at your facility, you can't manage the patient. Can't refer the patient to another facility that can be able to manage the same condition to avoid antibiotic misuse and overuse and resistance. Number 3, health promotion. Promotion to the community. Let us have national days to celebrate or remind people about the antimicrobial. I'm sure most of the hospitals in Kenya celebrated it. They have banners all over towns. Yeah, that was a good thing so that the community can understand what is happening to their body systems. Number 3, still on the health professionals. Mostly kwa wenzetu wa those who have chemists and pharmacists, kindly liaise with the nearest hospitals so as you can reduce the for-the-counter prescriptions or for-the-counter drugs. Big biashara, pharmacy, you can't do without them. But it's a multi-central collaboration so that we can combat this. Yes.
Pharmacists who don't sell drugs to anyone without them getting tested, right? And some time back, was it 2021, we had this so-called gonorrhea here in our country, and it was resistant to all the non-antibiotics, all the antibiotics that we have. What are some of the other conditions in our country that doctors are struggling to treat? Because maybe for people with these conditions, all the drugs that we have, the ones available cannot treat their condition.
Oh, okay. Now there was this super gonorrhea. It brought a public scare. Yes, sana ilikuwa metropolitan, but Nairobi, the counties neighboring the metropolitan. The streak was so resistant to most of the antibiotics. Gonorrhea it's brought about by an organism called bacteria called Neisseria gonorrhea. Gonorrhea has been very rampant. It's a very common condition, even in our reports. Most of the hospitals in Kenya, their monthly reports, they will get gonorrhea, UTI, urinary tract infection, syphilis, most of those conditions of the urinary tract. For these conditions, patients tend to hide or to shy away from going to the hospitals until now it's getting out of hand. Now they cannot control the condition. A condition like syphilis is a very fun condition because no symptoms. There's no painful urination, there's no discharge. So the patient will have to stay with this condition even for years. We have primary syphilis, secondary. So for primary syphilis, no symptoms unless you see a pimple on if it's a male, you might see a pimple. It's called a chancre on the penis. It might be painful, but it might disappear in 2 days of antibiotics. So once you take antibiotics for 2 days, the thing disappears. For female, you see the reproductive system of the female, it's not more the outside than ours than the male. So it's very difficult to see a pimple. The same people can be suggestive of syphilis. So these conditions are it's a menace to the medical industry, but we are still working on them. Yeah.
Thank you so much. That is how we are going to be wrapping it up for today. I think what we've been told is that it takes collective duty in order to prevent antimicrobial resistance or antibiotics resistance. And it is a very, very risky situation because you're not going to know it is happening until you are sick, until you're having surgery and you're told all the medications are not curing. So for you back at home, for the health professionals, for the government, let us all do our loss in preventing drug resistance. So Dr. Ken, thank you so much for enlightening us.
Yes.
I think we are all impacted. We are all learning people today because into all of this. So what is your parting shot, tell people that you're going to be seeing them next time?
Okay.
Yeah.
Yes, as I said, Kennedy, thank you for viewing us. I'm sure you have benefited. Najua mnasaidika hapa na pale. So mtu akipata shida ya mwili asinunue kadawa na hapo aende kwa hospitali atibiwe. I'm sure tutaonana huko kwa streets. Tukionana huko kwa streets msiogope kunisalimia, nitawaadvise further.
Asante sana.
Karibu sana.
Yeah, it was a nice session. I also got to learn a lot more on drug resistance. So thank you so much for tuning in. See you on our next episode. Same time, same station here at GTN, the home of gifts and talents. I have been your host, Mumbi Mavuti. As we always say, your health is your wealth, so protect it with everything you can. Thank you.
Thank you.